do things that you enjoy, right? Don't do them because you feel like you have to. If you're not a gym person, then don't waste your money on the gym. If you're not a treadmill person, don't waste your money on a treadmill. Do things that you want to do. Go out and play with your kids. Go out for a walk by yourself and get some fresh air, or do it with someone else, or listen to your podcast or Audible or whatever.
Welcome to Living Real Change, a podcast from Piedmont Healthcare. I'm your host, Dr. Lacey Knight, Chief Health Information Officer here at Piedmont. Join us as we highlight the people, the stories, and ideas that are transforming care and strengthening communities across Georgia. From inspiring patient journeys to expert health advice, each episode offers insight, hope, and a closer look at what real change looks like in healthcare today. Today's conversation tackles a topic that affects millions of Americans: weight, health, and the often overwhelming options around how to manage both. We're joined by Dr. George, a metabolic surgeon and obesity specialist at Piedmont Healthcare. He's passionate about helping people achieve lasting health through a combination of medical, surgical, and lifestyle tools, meeting each patient where they are. In this episode, we talk about how weight affects overall health, the new treatments that are out there, and why real, lasting change is about more than just the number on the scale. I am very interested in talking to you about this, so it's great to have you on the podcast today.
Thanks for having me.
Well, first, I'd love to know maybe a little bit about kind of the background. What brought you in this direction? How did you choose this medical specialty? Maybe why this is a personal passion of yours.
Yeah, so, my background is in general surgery. That's how I did my residency. Even predating that, I started the medical field, joining the military when I was 17. So I was a active duty corpsman for 6 years, and that's how I kind of jumped into taking care of people. And then once I went to medical school, I kind of started down the surgical path. And initially, my plan was to do high-level surgeries, minimally invasive surgery. Bariatric surgery is really a high-level, minimally invasive surgery that we do for people that need to lose a significant amount of weight. And, between training and then going into practice, I was just amazed at the results that we got with people losing their weight and helping them with all kinds of health conditions, diabetes and sleep apnea, and getting them off their medications and such. And then, the last few years, my surgical practice was obviously getting busy, but I noticed that more medications were coming out in the market. Medications that were originally designed for people with diabetes, but then, we started getting more weight management medications. And, I'm a firm believer that, you don't need a hammer for everything. So I said, I'm going to go out and get my board certification in obesity medicine and really try to help people, with their weight management using sort of other tools.
That's awesome. So is your practice split between some surgical options and then some non-surgical treatments?
Yeah. We have a comprehensive weight management program that basically starts with letting people get their foot in the door. And depending on what they've done in the past, depending on what their goals are and how much weight they're trying to lose and, things like that, then we have an initial conversation, and then we sort of try one thing or try another thing. And sometimes I need both things, but my practice is both.
Okay. And how do people end up getting to you? Is this something that people kind of reach out directly when they hear about your expertise, or you commonly a pathway from the primary care doctors, or how do you get connected with most of the patients that you end up seeing? Referrals from other specialists?
Yeah, that's a great question. I was in practice in Chicago for about 6 or 7 years, and probably 3/4 of the people that I saw and took care of were self-referred. They found me on Google or word of mouth, and maybe 1/4 were referred by doctors or other providers. I've been to Georgia now for a few months, so I'm relatively new. And it seems like that ratio is kind of the opposite. It seems like I'm getting more referrals from providers, and the self-referred people that are coming in is a little bit less.
Well, that's interesting. Any thoughts on why, or you think people are just still learning about the specialty in Georgia?
Yeah, I think that there's probably a couple of factors at play. One of them is that the there's going to be I don't know if I would call it a subculture, but different parts of the country, different states, different areas probably have different experiences and different thoughts. Just like, we're not going to obviously talk about politics today, but people's understanding or the thought about their weight and their health, it's probably going to be different in different parts of the country. So that might be one thing to do with it. And the other thing is obviously that I'm pretty new to the area. I mean, there's other established weight management programs in Augusta here where I'm at, but most of them are surgical based. And the fact of the matter is that only about 1% of eligible American adults, meaning eligible for bariatric surgery because they meet criteria based on their body mass index, actually get surgery, which means that we're only scratching the tip of the iceberg. So the other programs in town are mostly bariatric surgery focused, and the medical weight management piece is primarily done by the primary care doctors out there. So
Okay, that's interesting. So, I'm an ER doc by background. I did train in Chicago, so it's nice to know we have a commonality there. And what I'm used to is maybe the old days where the definition was strictly based on body mass index. But I think in our conversation, you've kind of highlighted maybe that there's some, or maybe in some information I've read, there may be a difference between kind of the health component and the weight component. So when you think about weight management, how much of it is based on either a textbook number or a certain weight that people may want to lower versus the impact of weight on someone's health? Maybe talk through those concepts or even the criteria by which it makes sense for patients to consider seeking some help.
yeah, absolutely. The body mass index, which is your weight divided by a height, is a sort of it's a metric that's been around for 35, 40 years. It came out in the original sort of guidelines that insurance companies used when they wanted to discuss who was sort of a candidate in their book for bariatric surgery or not. And I think it's an outdated metric. So there's obviously a very strong connection between someone having overweight or obesity and having a risk or getting health problems. And so the vast majority of people know that once you increase your weight to a certain point, it's going to impact everything from, your quality of life, your life expectancy, things like that. So there's no doubt that we use weight, we use increased weight, we use BMI as criteria for trying to figure out which pathway or which tool would be best suited for somebody. And, the analogy I like to give people is if you're going to go out and buy a car. You're going to start with your goals. Are you trying to pull a trailer? Are you trying to get good gas mileage? Do you want to off-road? And so that's going to guide what dealership you go to and what kind of performance you can expect out of a certain treatment, whether it's going to be weight management medications or surgery, right? So let's say you're trying to lose, I'm just going to come up with a number, 150 pounds. That's kind of like asking, and you're trying to do that, let's say with just diet and exercise. It's not impossible. I never say impossible, but it's very, very, very tough to do with that alone or without help. And so it's kind of like asking a Toyota Prius to go over 100 miles an hour on the freeway, right? You can put your foot on the gas, put a hole in the floor. You're not going to get that Prius over 100. So yes, body mass index and weight are incredibly important, I think, to help us get a general idea of pathway. And of course, insurance companies pay for the majority of this. So we need to make sure that we're following sort of their guidelines. But I'll kind of say the second part of my answer is this: metabolic health is incredibly important, right? And what we've realized is that someone doesn't necessarily have to be extremely overweight to have conditions like insulin resistance or prediabetes, diabetes, fatty liver disease, risk for coronary artery disease, risk for certain types of cancers. And those types of health conditions, right, are, while they're related to increased weight, it's not like a direct linear correlation. So what I'm trying to say is that people shouldn't wait until their weight is so high and they're on a number of medications and their quality of life is poor to go get help. They should start thinking about their health and their weight very, very early on.
Okay, that's super interesting. Does that mean that it's I don't know that it's easier to treat when it's early, but is that true?
Oh, 100%. 100%. I think that, I don't want to go down the rabbit hole with preventative medicine and education, health education, but I do think that they play an extremely strong role in habits. This is all about habits, right? It's about psychology, it's about education, it's about making choices to have a healthy, balanced, sustainable lifestyle. At the end of the day, medications or bariatric surgery are just a tool, right? I can, do the world's greatest fill in the blank surgery. I can put someone on the world's greatest injectable medication. But at the end of the day, if you're not doing some of these other things, having balanced nutrition, moving and having, consistent activity, high quality sleep, chronic stress management, all the other types of things that are important, then what happens is you see this with people that come off the medications. You see this, unfortunately, in people that have had bariatric surgery in the past, where their weight may come back up again. And so we're trying to, if you can, if people can learn some of these things early on, number one, they'll avoid this trajectory of needing some of these things like bariatric surgery medications, and also their quality of life is going to be probably better for a longer period of time.
Okay. You mentioned, kind of building off of that, you mentioned that you're involved in a comprehensive center in Augusta, and I was curious if what other types of support resources are part of that program or part of your practice to recommend for patients. It sounds like it's more complicated than just medications and surgery.
Yeah, 100%. So we have obviously registered dietitians that help us with people, whether it's solo or as part of a medical or surgical program. Psychologists that focus on cognitive behavioral therapy, right? So the science of changing habits. Physical therapy, we have a very strong physical therapy department, both for pelvic floor and for general physical therapy. We use modalities such as metabolic carts, so we can calculate someone's resting metabolic rate. So we have an objective target for meal plans. And of course, we have the a staff of medical providers, nurse practitioners, and physicians that this is what they do. This is what they specialize in.
That is amazing, and I think I learned a little bit. I did not realize you had all those roles supporting, kind of maintaining a healthy weight.
Yeah.
So I think one of the things that you mentioned was a challenge has to do with both cultural norms and habits. If I'm somebody that is kind of wondering, whether or not I should seek expert care like yours, I did hear that if I have a diabetic or if I've got some insulin resistance, that might be a reason. Maybe you could talk through some other triggers that might prompt me to consider reaching out to see someone like you.
Absolutely. It just kind of boils down to what you want with your health and your life in general. Sometimes people will do it for themselves. Sometimes they'll do it because they start realizing that they've got family that they want to live longer with and be healthier with, kids, grandkids, things like that. Sometimes the trigger is noticing that their quality of life has started to decrease, or maybe it's a health scare from seeing a doctor who says you have XYZ condition or you have a risk for that condition. So we sometimes will encounter what we call wake-up calls in life. And obviously it's different for everybody. Some people will have a wake-up call and they'll still maybe not decide to pull the trigger and get help because of whatever reason. I mean, there's a big component of, wanting to do it yourself. There's a big component of saying, you know what, I'm going to go out and try and do a diet, sign up for the gym. But unfortunately, the vast majority of people that I help take care of have already done this. The average American adult has tried to lose weight by themselves around 10 to 12 times. And unfortunately, the data shows that about 90% of those attempts will be unsuccessful, right? And, we're all getting older. Our bodies and our metabolisms are changing. So it gets more and more difficult. And then you start getting this yo-yo effect with your weight. You start feeling frustrated, maybe carrying some shame around, guilt, whatever it may be. And so some people just say, I've had enough and I've tried and I gave it a good shot. And now I'm not afraid to go and ask for some help.
That's pretty fascinating, and I think that makes sense. I heard you say that really a small percentage of people end up with the surgical option, and that there's a lot of new drugs that have created some excitement in the industry. But I'm curious, kind of what do most people end up using to get started? Because I can imagine that a lot of people really just they don't want to face surgery as the first option, and they may not even want to go on medications. But how do you approach this in the beginning to help those people that are just looking to make some progress?
Yeah, so I mean, I start by listening. It's probably helped that I've been married for 10 years, and I just kind of keep my mouth shut and I just try to figure out how we can help people. Um, we're in the business of solving problems. And so obviously people don't want to go to see a doctor necessarily. They don't want to ask for help, but if they're coming in to see us, it's because they're probably at their wits' end. If they've been referred by somebody, I always kind of joke around and I say, well, did you come in because your doctor put a gun to your head, or do you really want to be here? Because,
That's good.
sometimes people aren't sure, and there's nothing wrong with being on the fence, and they're just, you know, coming in to see us because they want to know some information. They want to know their options. But it really kind of starts with them and their goals. I'm less interested about what a BMI chart on the internet tells me or an ideal body weight calculator. And I'm really more interested in having someone tell me what they really want. And so if the goals come from them and they're invested in this, then they're more likely to be successful. And we all know goals can change, right? We may say our initial target is to get our A1C for diabetes down to this point, or it may be to get our weight down to this point, or fit into this certain clothes size, or to not feel like I'm falling asleep all the time at work. But it starts with that conversation and then we go from there. But yes, a lot of people, they don't want to take medications. They don't want to have surgery, which is understandable, but they've already tried to do it by themselves. And we do offer a completely holistic program that, it's medically supervised. We are still going to check for things like endocrinopathies, like hypothyroidism and PCOS and things like that. But we don't necessarily have to do medications if someone doesn't want to. We still get them plugged in with the psychologist and the dietitian. We give them some meal plans, go to the support groups, and have them come in to see us on a regular basis so we can slowly work on helping them with their habits and their lifestyle.
That's great. It's good to know that there sounds like a lot of different types of options that can be tailored to meeting people where they're at.
Yeah, 100%.
So what does the kind of the environment or the future or the research look like in this area? I mentioned some of the new drugs that I think are really popular. People know about that, but what are what are we learning about obesity or these metabolic conditions that maybe we didn't know 15 to 20 years ago, or where do you think this field is headed?
We are starting to scratch the surface with our understanding of hormones and how our brain and our body and our intestines talk. That's how bariatric surgery works. That's how some of these medications work, by working on that sort of that hormonal communication between the two, between the brain and the intestine. And the type of work that we're doing now is more focused not only on the battle against certain hormones like chronically elevated cortisol, right, which is responsible for everything from food noise, right? People feeling hungry a lot. It's the stress hormone, right? It increases things that increase your appetite, increases fat storage, and things like that. But also, I would say, besides obviously working on helping people with their hormones, is the psychology, and it's the habits. It's understanding your relationship with food, right? And starting to understand that there's more than one trigger for putting something in your mouth, whether it's not just appetite. It's going to be stress or boredom or things like that. So being more intentional, and reversing the dynamic so that you have control of that relationship. And so a lot of it's going to be with the psychological piece. And I would say that the third piece is going to be really just educating. Education, I think, is incredibly important, regardless of how people do this to get their health and their weight on track. Whether they go to our program or they they do it again themselves. Um, but but we can make better choices when we're better educated about these things.
Okay. What role does uh, physical activity play in your program or in this overall health and wellness piece?
Yeah, physical activity and movement are incredibly powerful, for many, many reasons. And so I think that at the very basic, I always encourage people to walk, which can be tough based on your lifestyle, the type of job we have. If we're in a sedentary, sit in the chair type of office job, it can be hard. But walking and movement are great for just getting blood flow going. It's also a great way to build a calorie deficit, because if you're trying to lose weight, you need a calorie deficit. So, getting, even if it has to be inside, but, outside walking is great. Obviously the FDA has recommendations on, what is considered the minimal activity level for people, right? So 75 minutes a week of vigorous exercise like running or swimming, or 150 minutes a week of moderate exercise. I used to tell people a lot about those criteria, but really more what I talk to people about is just do things that you enjoy, right? Don't do them because you feel like you have to. If you're not a gym person, then don't waste your money on the gym. If you're not a treadmill person, don't waste your money on a treadmill. Do things that you want to do. Go out and play with your kids. Go out for a walk by yourself and get some fresh air, or do it with someone else, or listen to your podcast or Audible or whatever. The second thing that I think physical activity is incredibly important for with our patients is strength training. I tell all of our patients that they should be doing 2 to 3 days a week minimum of consistent strength training, because when you build lean muscle, you increase your metabolic rate. And when you increase your metabolic rate, right, you're going to have the tendency to burn more calories and lose weight if that's what you're trying to do. So you look better in your clothes, your self-esteem goes through the roof, your energy goes up. So those two things, consistent movement that you enjoy and strength training, I think should be part of it in everybody's life.
That is great advice. And these are all part of the program that's there through Augusta that you're in.
Yes, 100%. That's this, we obviously will start with getting an understanding of someone's baseline, and then we'll set them up with an expert, because we don't want someone to get injured. They may not have experience with certain things, but we do get them set up with the relevant resources.
Now, it sounds like you have a lot of experience and familiarity with other types of programs. What do you think may set the Piedmont program apart from some others?
I think that Piedmont is, number one, it has an extensive network of primary care providers, physicians, mid-level providers that are providing care to our community. And that they're sort of like the front line of all of this. They're the ones that are seeing people every day, either for a direct reason or an indirect reason connected to that person's weight, if they have overweight or obesity. And so, I think that they are already, a lot of primary care providers are already providing some type of education, some type of support when it comes to losing weight. But because of that vast access to the population, I think that that allows us to really have a high enough volume that we can be very good at what we do. Because if you're going to go, for example, down the bariatric surgery route, you want to get it done at a place that knows what they're doing. They have a highly specialized team that does this every day, all the time, and they're very good at this. That's how you're going to get your best results.
Okay, that's great. One thing I forgot to ask earlier is I think in the old days, surgery kind of meant one option, but I think nowadays there's a variety of different types of surgeries that can be offered. I'm curious, how do you walk through what's the best surgical option if you have somebody that you both believe requires surgery to get to the outcome that they're desiring?
Yeah, that's a great question. You know, my analogy is always about it's a toolbox. And even within surgery, there's different options there. So you're going to get a certain amount of performance out of a certain kind of tool. And, if someone's trying to lose, let's say, more weight, I may talk to them more about a surgery that is going to allow them to lose more weight. If we're looking at someone that has longstanding diabetes, or let's say someone has a history of heartburn or reflux, all of these little considerations, we put them together and then we say, well, which one of these procedures is most likely to get you to your goal and obviously help you maintain there and also not, let's say exacerbate or make a medical problem worse. So it's kind of like a cost benefit analysis that we perform. And ultimately it's going to be the patient's decision, right? I never want anybody to feel like they've got a gun to their head, that they're being rushed into something. My job is really to kind of, to help with the educational piece and to help them weigh the pros and the cons. But ultimately, there's also lifestyle stuff that goes into this. Some surgeries require more attention long-term, to taking your vitamins, to following special blood work. And those types of surgeries, if, I'm not sure that someone is going to be able to handle that long-term, even if they look good for the amount of weight that they need to lose. We may say, hey, let's think about something that's a little bit less intense on, you need to stay on top of those things.
Wow. This has been really great information. I've enjoyed talking to you about this. I don't know that I'm in the medical field and I did not know this much about these procedures. And I really appreciate hearing how personalized your approach is to helping people solve health and weight challenges. And I think that's really special. So kudos to you and team for creating something that allows each person to kind of engage and participate in the decision making to get to the outcome that they want. I think that the last thing I'll ask you is if you have a message for those that are kind of considering whether or not this is something to look into, what would you like to leave us thinking about?
Yeah, I think that for anybody out there that is even remotely wanting to improve their health or get themselves on track with their weight or both, and especially if you've tried before, if you've tried multiple times, if you've been doing the yo-yo thing with your weight and you're starting to feel frustrated because you lose weight and then it comes back up again, don't be afraid to ask for help. It's okay to do that, because at the end of the day, it's not just your life, obviously, that you want to improve, but also your family's life, right? And I think that, I always tell people it's not just the number on the scale. It's about how you feel. It's about your quality of life. So those types of things, obviously have to come from inside, but I would say it's never too late to ask for help.
Thank you for listening to Living Real Change. To hear more stories from across Piedmont Healthcare, be sure to subscribe and watch for upcoming episodes. For additional health tips, news, and resources, visit us at piedmont.org/living-real-change.